Soon begin using artificial intelligence to help out staffers. KLTV7's JD Conti spoke with hospital leaders who tell us the software will actually help speed up the scheduling of surgeries.
In the midst of new buildings, new technology.
Less phone calls, less coordination because we now have a tool that automates several of those processes for us.
Jimmy Clark is the Chief Operating Officer of UT Health East Texas at Tyler. UT hospitals across East Texas will soon use an AI tool to assist scheduling surgeries. The software will help identify gaps in surgeons' schedules.
And when their schedules are open, they'll receive a nudge from the software, notifying them that an operating room is available.
The AI will also consider other factors needed for surgery.
Between clinic schedulers, OR leadership, physicians and patients, of course, and this tool will help us automate a lot of that workflow.
Clark says the AI will not have access to patient medical records.
A lot of people hear AI and automatically go, So what do you say to patients who hear that and are automatically, a little scared?
Yeah, really this technology is just pattern recognition, behavior recognition to allow us to operate more efficiently. It really is not, the patient will not feel much of a change.
Clark added the software could decrease the time it takes patients to get into an operating room.
And with this technology, we'll be able to identify gaps more timely, and that'll result in more timely care for patients.
JD Conti, KLTV7 News.
And UT hospitals will begin using the software October 21st.